Welcome back. It's 5:12 here on this Tuesday. So today, the Centers for Disease Control will meet to discuss approving the Pfizer COVID vaccine for kids 5 to 11 years old, a really big vulnerable age group.
And if approved, we could see children in that age group getting the vaccines as soon as this week. And for parents out there, you know, we know that you have a lot of questions about this. So 10 TV's Krista Frost talked with a pediatrician to find out some of those things you should know. These are really, Krista, frequently asked questions.
They really are, and I want to just start by saying there's really no thing as a silly question. I know a lot of people know what I'm talking about when I say that, but pediatricians that I talk with say, ask them anything. That's exactly what they're there for. That's actually what I did yesterday. Is I reached out to a pediatrician who actually also is an associate administrative medical director here at Nationwide Children's Hospital. So she kind of works as a liaison between the hospital and other pediatricians, and so she gave me a lot of the answers to what people wanted to ask. So some of them is, how soon could kids get this vaccine if it's approved today? Again, that age for 5 to 11. And she says that they could have that vaccine, if approved, that's by Thursday. So they'll get a third of the dose that adults get 3 weeks apart. So doctors will actually have to special order that supply. They can't just dilute the doses that they have for adults to make it work for those kids. Now, while we know that kids don't typically get as sick as adults do, it's still possible for them to get COVID. So you should consider the vaccine. Now, Dr. Michelle Gola, that's her name, she told me that there's more to worry about if your child does get COVID.
MISC, and that is a concerning hyperinflammatory condition that kids might get 2 to 6 weeks after getting COVID-19. So they might have an asymptomatic case of COVID-19, meaning they have no symptoms from it, but then at that 2 to 6 week mark, they get a high fever, maybe low blood pressures, maybe even go into shock and end up in the ICU.
So that was actually pretty new news to me and actually very shocking. And that's just one of the illnesses that can come as a response to getting COVID for kids. Doesn't happen for everyone, but it can happen to some. So that's something that you want to keep in mind if you're thinking about to get your kid vaccinated or not. Now, I asked her so many other questions about how this vaccine works, what decisions you should be making as a parent, what kids should be thinking, feeling, and what they could expect if they get the vaccine and if they're approved. Come that meeting from the CDC today, I'm going to have so many more answers. That's coming up at 6. But for now, reporting live from Nationwide Children's Hospital, Krista Frost, 10 TV News.
Krista, thank you. Now, the director of the Ohio Department of Health says that kids should still stay masked in schools even through this whole vaccination process, but a lot of schools are going in the opposite direction. In fact, we took a look at the state data showing that many school districts are getting rid of their mask mandates, making them optional now. So we made this graph for you, taking the data from the State Department, and you can see it goes by district name in alphabetical order, but you can also search by county. You just have to change up this sorting here. But this is the column you really want to take a closer look, where it tells you which districts are going optional for students, all students, or required for all students. So it's a really good tool. It's a lot to digest, so we have this for you on 10tv.com. But really, since last week when the state announced that new mask to stay, test to play policy, we saw 39 more schools, Tracy, make that change to their mask policies.